So our mum is Lesley. She is 62 years old. I don't want to. Yeah, she's 62.
Yes, she is.
She was diagnosed with something called vagus granulomatosis in 2005. We don't call it that anymore. It's now called GPA, and it's a rare form of vasculitis. She had the treatment she had for it was one of the first. She was one of the first people in the country to be treated in this way. So she had something called rituximab, and cyclophosphamide, which is a chemotherapy drug, and high dose steroids. The consequences of those treatments are that her immune system is really depleted chronically, and she's now developed something called common variable immunodeficiency. Which means essentially that her antibodies don't work. Two of her main antibodies are non-existent. She's been trialled on loads of different vaccines to see if her immune system will respond to them, and it's had absolutely no effect whatsoever. So when she gets poorly, she has a delayed response to that. So whereas you and me would get sick straight away and become unwell, she might feel unwell, but it won't be to the same levels until the infection is really, really severe. And normally at that point, she needs hospitalisation. We knew that she was susceptible to infection, and she takes a daily dose of antibiotics as like prophylaxis. But that's really it. And she was obviously, when she got poorly the first time with sepsis, it was during COVID, so she was actually shielding. And she was in hospital for something completely unrelated to what she actually ended up becoming septic with. She is also she's very complex. She also has ulcerative colitis, and at the time had diverticulosis, which is like the precursor to diverticulitis. She'd gone into hospital because she'd broken her leg. She'd fallen at home and broken her leg, and they'd taken her to a smaller unit rather than the main trauma centre because she was shielding, but they couldn't deal with her because she needed an operation to fix her leg. They couldn't deal with her post-operatively because of her condition. She might have needed ITU support, so they had to ship her back. And she was fine, actually. The operation went really well. She had the operation. They transferred her back to the main unit. She had her operation. She was recovering really well. She was mobilising. We were planning on getting her home. And then we couldn't get in touch with her. She'd been all the way through. We'd been like sending each other text messages and silly phone calls and memes and stuff, and we'd got nothing from her. And I'd rung my sister Jo and I'd said, something's not right here. And then the following morning, I tried to ring her after I dropped the kids off at school, and she didn't answer at first. And I rang her again, and she answered, and she just sounded slurred. I couldn't really get anything out of her that made sense. And I said to her, oh, was everything all right, Mum? And she said, this bit did make sense. And she said, oh, I've got to go. All the doctors around me. And I said, what do you mean? And she said, all the doctors are here. My blood pressure's a little bit low. And I said, what do you mean your blood pressure's a little bit low? What is it? And I heard her ask the nurse. And in the background, I heard the nurse say it's 60/40. And at that point, I was like, right, I need to go. I need to go over. And I'd called my sister, and we travelled over to the hospital together. Despite it being in COVID, I don't know how we managed it at the time, but we managed to get into the ward. I think we'd had to LFT to make sure that we didn't have COVID. And we got there, and she was confused. She was edematous. Her blood pressure was, I think it had come up to 80/50 or something ridiculous. And she'd had about 3 litres of fluid at this point. She was on oxygen. She just looked awful.
Yeah, I think we've seen it before. Obviously, when she became really unwell when we were a lot younger. So to see her like that was horrific. It will never leave me. It will never leave Lorna. And then following on from that, the fights that we had to put up for medical professionals to listen.
And they
didn't listen still. And it went the way we told them it would go, to the point, you know, that mum's obviously ended up with a colostomy bag for the rest of her life, because they didn't listen.
So I actually suggested it on the way en route to hospital, because we live about an hour away, but we're about 40 miles away from where mum lives. So on the journey over there, I actually rang and spoke to one of the junior doctors, and I said, you know, have you considered infection? And he said, no, her bloods aren't showing it. And I said, no, they're not going to show it because her immune system is sluggish. It's not going to show it yet. It will show it probably tomorrow or the day after. No. We're just going with a stress-induced response, a cortisol deficiency,
Steroid,
I think they
yeah.
said. I said, okay. I said, well, given that you've given her 3 litres of fluid and her blood pressure has marginally improved, have you considered contacting critical care outreach? And he actually said to me, oh, that's a good idea. So thankfully they did. Critical care outreach reviewed, and to be fair, one of the charge nurses stayed with her for most of the afternoon. But she was also reviewed because she had an acute kidney injury, which is also a sign of sepsis. She was reviewed by the renal team, who said, it's documented in her notes, please consider sepsis and cover with a broad spectrum antibiotic.
And they suggested imaging as well, due to the question mark around where the infection source would be. They did say it wouldn't have been her leg, obviously following the operation. However, we noted that mum's abdomen was significantly distended, and tender on sort of palpation and stuff like that. We were told repeatedly, it's not her tummy, it's not her tummy. And obviously it was.
I asked the question from obviously my clinical knowledge. I even said to the doctor, have you considered peritonitis? Because she's been complaining of colicky tummy pain for the past 2 days. She says that she feels constipated, but she's not. And her tummy to us appears distended. That's not, she was lay flat and it was still bloated. And he said, no, it couldn't possibly be, her bloods don't reflect it. So later that night, I think it was about 9 o'clock, they transferred her to critical care because they'd put a catheter in. She wasn't passing any urine. Her blood pressure still hadn't improved. So she went into critical care. And the following morning, she became more unwell. Her heart rate went up and she went into an arrhythmia. And the bloods that they'd taken that morning showed that she was septic. All of her white blood cell counts had shot up. And they finally, after 24 hours later, gave her a first dose of antibiotics. She stayed in ITU at that point for, I think it was about 4 days, with no investigation into the source of sepsis. They'd done a chest x-ray because they stuck a central line in and her chest was clear, and they dipped her urine when they put a catheter in and that was clear. She was still complaining of abdo pain all the way through. And because her bloods had improved, they discharged her from ITU back to the ward. And then 8 days later, she was still in hospital. She'd stopped eating. She wasn't drinking. She wasn't going to the toilet because she wasn't taking anything orally to pass anything. Her bloods were still deranged and had started to get worse. And she was reviewed by a gastroenterologist to see whether or not it was an ulcerative colitis flare-up. At this point, they gave her an enema and she started bleeding. And the gastroenterologist said that he wanted to image her abdomen. And he actually did it. Lots of people, she'd been seen by multiple different specialities throughout the last 8 days, and all had suggested that they imaged her abdomen, and nobody did. When they did, they found she had burst diverticular abscesses, and the following morning they took her to theatre and they put a colostomy bag in, and the consultant rang me after the operation and he said, "I'm really sorry, Lorna. I have done absolutely everything I can, but I don't know if it's enough and she might not survive this." Ugh, it's indescribable. I'll be honest, the anger I felt at that moment in time, because I told them this 8 days before, I was beside myself. And thinking that she'd been in pain for so long, and they could have worked this out a week or more before. It was absolutely heartbreaking.
We were actually together. We were at Mum's address with our stepdad. Heartbroken. Like Lorna said, obviously the thought of Mum being so poorly, and being in so much pain absolutely kills me. And again, it's, if they'd have listened, you know, they may look at us and say, well, obviously Lorna is, you know, a registered nurse. I'm not, but listening to families, they are the people that know that person the best. We've been round and round with Mum, obviously, with when she was diagnosed with her form of vasculitis and all of those different things. We've been there. We're the people. So yeah, I think we were able to head up that evening to see her post-op, and we were allowed to go into ITU. So obviously she had been taken there again, and she looked well, considering. She looked a hell of a lot better than what anybody anticipated.
She looked amazing.
She said she felt so much better already in such a short period of time. So then it was just sort of the weeks following that, wasn't it, really, of her building herself back up. Obviously coming to terms with the fact that she'd got a stoma, learning how to use that, and then being obviously discharged. I think me and Lorna will say she was most definitely discharged too soon. She wasn't given the adequate support physically, you know, to manage the stoma herself, and sort of checking that she would be safe in a home environment. That wasn't done appropriately. Thankfully, we were able to avoid another ITU stay, but that didn't happen without a lot of stamping of my feet towards doctors. Mum did become septic again, however avoided ITU. That came down to a infection in her abdomen, again in her bowel, but on the other side. So I took her to hospital because she was complaining of abdo pain. She looked unwell. Her blood pressure, in the end, I was taking it in the waiting room because nobody was listening, and I could see Mum was deteriorating, to the point that her blood pressure was dropping, her temperature was coming up. They said again, her bloods don't reflect it. Her infection marker is up, but her white cell isn't. And I had to be quite forceful and say, it's not going to. you need to listen to me. You've nearly killed her before. I'm not letting you do that again. And I made the sort of suggestions. Me and Lorna were talking over the phone, and I said, she was like, right, suggest this, this, and this. So I did all of that. Thankfully, this time they did listen. But like I said, it didn't happen without a lot of stamping of my feet. I think if I hadn't been so forceful, I dread to think where we would be sat now. It's horrible because I want to be able to just be the daughter who's just there to support your mum that's unwell. Instead, I'm having to be the daughter and then somebody that's fighting my mum's corner because she's unable to do so herself. I can say now doctors didn't like me at all. But I'd like to hope that they would understand once they'd listened to what I'd said and actually read her records, because I had to say that multiple times. She's, these are her medical conditions, read her records. And we shouldn't have to do that. It's really sad that it takes those sorts of things to happen. However, I really do hope that it's used in the correct way and it is there, and it to support those families and those patients that are unwell and who potentially don't feel they're being listened to. And it makes doctors and nurses take a second think.